This is a this is a support from the Foremost organization, and here we are live addressing about healthcare issues and what we need to focus. We have been yesterday we talked about uh, President Biden's plan on healthcare, and we'll continue to talk about the same issues. Um, our main focus is public option. This is this is public option. I just want to make sure that we are addressing the concerns what I expressed yesterday regarding the. I would rather have a public-private partnership than public option. You know, the more and more I see, more and more I see. It's not nothing to do with healthcare, folks. It's just all about control. When you talk about this healthcare, why can't we collaborate with private and public partnership and set up which is conducive to the everybody, all Americans, irrespective of their economic status, irrespective of their employment status, irrespective of. And health review board is appointed by the public-private partnership, and health review board determines who is eligible and who is not eligible. They will evaluate and they will assess individual applicant, and they can give a certificate of guaranteed coverage. By doing that, everybody gets to have the same private insurance, and that is a better way to go than this public option. I've been looking at this Medicaid and Medicare, Medi-Cal, and all this public option policy, and this covered California. I'm not even sure what the covered Cal. I need to look into that. Maybe one of these days I will dwell on covered California. And I was seriously looking at how do we achieve personalized healthcare for all Americans. Yes, all Americans. This is what we need. We don't need this people on with different categories and this and that. We need private insurance for all Americans, and they should be able to choose their doctor. They should be able to choose their plan. They should be able to get the medications what they need. They can monetize themselves rather than by the government. This is where this is where my focus is on health insurance personalized, which is easy to set it up, which basically what I'm suggesting is health disclosure, healthy premium, healthy pricing, HTHP accounts. Anyone can apply, and if suppose the applicant is rejected, this health review board will issue a certificate of guaranteed coverage, and that will lower your premium. Simultaneously, the funds saved in the HTHP from the HTHP premium payment, funds saved from there is money put aside into Health Solutions Advantage, which is an HSA accounts, and that is yours, and that's everybody has to have it. Everybody has to have it. Health Solutions HSA accounts. So that way, that is has a triple tax benefit. Contributions are tax free, and returns on your, if you invest in the whatever into the market, your returns are tax free, and your withdrawals for your health care is tax free. You can't be anything better than that. I would like to see everybody have HSA, Health Solutions Advantage. And I also want I would like to see all the 160 million blue collar workers. There are hard working families with individuals and families. They should be able to get HTHP accounts along with HSA, which gives you personalized healthcare. Okay, let's talk about certain, after addressing the initial concerns, let's talk about certain issues from the Biden plan. From yes, I've been going over this Biden's plan, President Biden's plan. The Senate, I'm pretty sure it is going to be President Biden will, the powers will be limited because this is a divided government. Checks and balances. That always works out better. When you have checks and balances in Washington, it works. I wish both sides come together. It will be an ideal thing for solutions for everyone to benefit. Most of these folks, when they talk about, general public doesn't understand the beauty of personalized healthcare. I really need to dwell more and more to the uh, public. That's why I'm going to start a podcast, YouTube podcast. So I will be doing the podcast. I'm looking into it, and this is I'm slowly getting into the streaming, and I want to see people make comments so I can address their concerns. And you can chat with me while I'm talking about it. Make some comments, and hopefully I'll get the messages. And you can chat with me, live chat. So, folks, if you're listening, I may not have much audience, but I'm slowly getting into uh, anywhere health related entities like American Medical Association, like HHS, Health and Human Services. I'm looking into that. Center for Medicare Services and Medicaid Services. I also am looking at other entities. Yesterday, I looked at one of these futuristic healthcare model, which is really great. I really thoroughly enjoyed it. Uh, I wish I can put that um, as a podcast. So one of these days I may have to televise and broadcast that futuristic healthcare, how it is going to be telemedicine, telehealth, and they have these nice portable ultrasounds and echoes, portable diagnostic tools, and how this information is exchanged between the doctors, patients, hospitals, and it's going to be it's go- like what we are doing now, the streaming and communicating with patients. It's going to be quite a revolution in healthcare. Coming back to this, okay, some of this Biden's plan, which are encouraging, but okay, they say reverse the Trump administration all out assault on women's right to choose. Women's right to choose what? Abortion? Is that what they're talking? Uh, Basically, laws like parental notification requirements, mandatory waiting periods, and ultrasound requirements. Obviously, this is focused more on the abortion. That is a very contentious issue. I Abortion is it's a controversial itself. For abortion for health reasons is different from routine abortion. Routine abortion should be discouraged, folks. I really, I have nothing to do. I'm not an extremist. I want to see for the safety of the mother. Yes, we need to look into that, but don't don't expand, you know, morality and getting pregnant and having abortion. It is not a routine stuff, folks. It is a serious matter. Getting pregnant, it's a serious matter. And you want to abort a child, abort a live child, live birth baby. Nowadays the healthcare, there are so many advances in healthcare. Once you have the fetus with a heart, how could you abort a live fetus, which is alive? Basically, they had the fetus doesn't have any rights. But who gives those rights to kill that live baby? This is what it is behooves me. I can fathom going to that level of. And again, I refuse to dwell on that aspect. But what they are trying to say is, when you're pregnant, parents need to be notified. You want to have a parental notification, which makes sense, and mandatory waiting periods, which are again, and ultrasound. You need to have an ultrasound. If somebody is pregnant, you have to have an ultrasound. Why can you not have an ultrasound? Because they need to see the status of the pregnancy. You need to get to. So those are the things they want to get rid of. I I I would like to see. We need to encourage to have a strong family. What is this life is all about? When you don't have a family, when you don't have uh, uh, moral values, what is this what we are looking for? We need to have a morality. Come on, folks. We cannot dictate and encourage people to be family oriented. Have to have. This is what we look forward to, raising a beautiful family. I have two children, and they followed in my example as a doctor. And my son is a cardiologist, and I'm proud of him. He's an interventional cardiologist. I'm proud of him. And credit goes to my wife. And I encourage a bond, a husband and wife bondage, and raise a beautiful family. And my daughter, we are both proud of our kids. And my daughter is a pediatrician. I'm proud of them. I'm proud of I'm proud of my wife raising beautiful children. What's wrong with that? Why are we destructing the family structure, man? I don't like when they destroy the family structure. And you know whom they are telling these things? When they destroy the family value, they're focusing on, you know, urban areas. Urban areas. These urban areas, there's a welfare society. They're encouraging welfare society. And they're encouraging people to get lose their morals. Come on. I just hate somebody doing that. I hate when people do that and lose the having no morality. It's it's you're destroying the entire structure of humanity. Let's not dwell on it. Every time people talk about, you know, actually, you know, I'm old fashioned, man. I'm old fashioned. You know, people living together having babies, fine, whatever they want, but still, I encourage. This Medicaid or Medi-Cal. This is the beauty. This is where the public option comes in. Public option. If a woman has a Medicaid or Medi-Cal for economic reasons, you know why they don't want to get married? because they lose their Medicaid card or Medi-Cal card. Because if they get married, they live together, they have babies, they have abortions, they want everything paid by the government. Yes, they want to be paid by the government, and they want to remove those laws. They don't want to be notified. The parents need to be notified. They don't want a mandatory waiting periods, and they don't want ultrasounds. What is this? Where are we coming to? Where are we? Where are we heading, man? Why? What is wrong? Again, I am not religious. I'm a Hindu. Okay, I embrace all the religions: Christianity, Muslims, and Hindus, Buddhists. I have no religion. Basically, I Hindus are it's like a culture. We want to maintain the traditional values. But when you do certain things like not notifying the parents if your daughter is pregnant, is that is it something? Is it a right to not notifying the parents? I don't get it. And you need to notify. You have again. You have to scientifically. Democrats focus on science. Scientifically, you need to look at the mother's health. How can you not do an ultrasound when somebody's pregnant and you're worried about the mother? You want the safety of the mother and the baby. What's wrong with having an ultrasound? They want to remove that. They want to get rid of the ultrasound. This is science. Science. This is what we are talking about. I thought Democrats focused on science. Every time we talk about COVID, and they blasted Trump because he was not following the science. Where is it? When somebody is pregnant, you need to know the status of the mother and the child, and what stage, how many weeks pregnancy. It is science. It's nothing to do with public option. Uh, the government gets involved into see as I mentioned earlier, this Medicaid card, they need to get rid of that, man. Medicaid is useless. Nobody wants it. Nobody takes care of it. And this, again, I'm not sure how this covered California is working, and I need to look into that. But right now, this Medicaid card is useless, man. I wish they take it out, get rid of it. Actually, even the Medicare needs a lot of reforms because what the Medicare, that's another story. When you, what the, I was just looking at while I was watching advancements in healthcare. Do you know these commercials? They come up with this in between this. They come out with a Medicare. This is an enrollment period. Till December 7th, we're going to be bombarded with enrollment. Enrollment. If you have Medicare, call us. We'll give you free eye checkup, free dental checkup, free hearing checkup, free meals, no co-pays, free rides. Yeah. You know what? They want your Medicare card, man. Medicare card. What does the Medicare card do? They want you to give up your Medicare card. You want to you want to do that really? You want to give up your Medicare card? What this Health and Human Services need to change. I already responded to some Health and Human Services. They believe in the intermediate, but they don't trust the Americans. This is so sad. They believe these intermediaries. They think the Americans are stupid. They really believe Americans are. If they give me that $1,200, I will get a personalized health insurance myself. I don't need Uncle Sam to tell me. I should tell me where to go, what to do, which doctor to. They don't need. Americans wants to be free from the shackles. We don't want to be told what to do. I will if the HHS, Health and Human Services, and AARP is listening, don't give up on your Medicare card. Don't get your HDHP account. And this is need to be facilitated. With the present day rules and regulations, you can't you when you give up on your card, you lose the control on your health. Basically, that's what it is. If you can afford it, if you have had HSA accounts, supplemental is the way to go. Supplemental will take care of the rest, the 20% aspect of it. Don't give up on your Medicare. If you can, try to see how, unless Health and Human Services stops pumping that money into these intermediary organizations, they should give you that money. ARP members demand that $1,200 into your pocket so you can go and get personalized health insurance and put money aside into HSA accounts, folks. I want ARP to we need I will contact the because I'm a member of the I want to contact the ARP members, demand that $1,200 into my pocket so I can get the health insurance what I need, personalized health insurance. I don't want anybody telling me where to go, what to do, what this is nonsense. They need to stop it. I would like to see even the Medicare need to be changed. This billing system, it's need to surprise medical billing. They've been thanks for the coffee, man. Thanks for that. I'm still waiting for some comments. So far, I have zero audience. I'm looking for the audience. I'm trying to gain people to ask questions. They can ask anything what they want on healthcare, man. This is Consumers Doctors Channel. I'm intent on having everybody having personalized health insurance so that they can put money aside into the HSA, even for the seniors. I'm going to go into podcasts. I'm going to get all the exposure what I need. But this is what I would like to see it happen is everybody to have a personalized health insurance. And what I would like to do is continue talking about Biden's plan. Doubling America's investments in community health centers. It sounds nice. Primary, parental, primary, prenatal for checkups. So President Biden wants to double community health centers. If you, this is where the beauty is. You don't need to do all that. Basically, community health center, if you set up this health review board will give the certificate of guaranteed coverage, and insurance companies will love it and cut down the regulations so we can lower the cost rather than funding this community health center. If you cut down the overall healthcare costs, private enterprises, they will set up hubs, any small towns, with telemedicine, telehealth, community health centers can be set up any remote areas. So why are we wasting money in setting up community health centers? Got it. We want to use the technology in our favor, not waste money. This Medicare is wasting, pumping money into these intermediaries. Very first thing they do is they restrict the care. They want to, you can see only certain doctor. You have no option of getting this medicine. You have no choice of having certain tests, and you don't have. If that, if you are free and if you have your own personalized health insurance with HSA, it is your money. You will watch your health. You will take care of your health and in a better way. You know what is good. Americans know what is good for them, and they know what is their doctor is going to recommend. And that is what we need. We need independence. We need freedom, not more health centers. We need freedom to choose the doctor. Okay, achieving mental parity. That's another beauty. Achieving mental parity, expanding access to mental health care. Yeah, let's go for it. But how you do it? You don't want the government to do it. You want to have a public private partnership, man. Public private partner. This is consumers doctor. I highly recommend to have a public private partnership where government don't need to spend any money. There's zero investments. And you give them the certificate of guaranteed coverage. If a family has an individual who is mentally sick, or if an individual is mentally sick, I see in urban areas walking on the street with their shopping carts. Most of them are mentally sick. Why can't they pick them up, taking to a nice facility, give them? This is where the focus should be, not mental parity, doing all this, setting up centers, implement the federal mental health parity law. You don't need, there's no reason to have a law. You can give them the certificate of guaranteed coverage and take care of the people who need the most. People on the street with their shopping carts. There's no possession. There's something wrong with these folks, and they're talking to themselves half the time. I have seen so many in Long Beach. They need to be picked up and to be taken care of. In This is where your funding should go to the mental health centers, where they can take care of you. That's again, it has to be under the laws of public private partnership. There's no reason to have more laws and more centers and more funding and more wastage of money. We all agree, improve the access to the mental. We all agree on that. Eliminate the stigma around mental. We all agree on that. But how you do it, provide the tools for the individuals. As president, he will redouble these efforts to ensure enforcement of mental health parity laws. It sounds good. It sounds good. I have no problem with that. But how you do it? The This is a nice slogan, man. Supporting health, not rewarding wealth. What does that mean? I don't get it. Are we in America or even in China? I'm not sure. I'm not sure what this slogan is all about. The This is for the folks in the urban areas. This is what they are doing. They are brainwashing. I see the supporting health and not rewarding wealth. But they take the money from these billionaires. George Soros is billionaires. They are all these globalists. They pump this money from George Soros. I don't know what his goal is, but he's pumping this money into these liberal policies, not rewarding wealth. What's wrong with having wealth? I don't get it. I just don't get it. Okay, Joe Biden believes in rewarding work, not just wealth. Well, if you work, there are Americans in general are hardworking people and not reward. They want, you need to invest in Americans. They want to make money. Everybody, all the, I see Americans are most hardworking people. If you go to Europe, you should see people in Europe. Half the time you know, they're having fun. They're enjoying it. Americans are the most hardworking people I've ever seen. Coming from India, I've seen people working 12, 14, 16 hours. Most hard. Their goal is to be independent, not reward wealth. What means not reward wealth? Having wealth is a good thing. Having to save money is a good thing. What do you mean not reward wealth? This is what it says in the manifesto. Hardworking Americans' health. Okay, I'm looking at Warren Buffett said it is best when he stated that he should not pay lower taxes than his secretary. Yeah, that's Warren Buffett could say that because you know he himself is writing off. Have him pay. If he wants to pay more taxes, who is denying that? Warren Buffett can pay more tax. Nobody, if you want, somebody wants to pay more taxes, government will love to take that money, man. What Warren Buffett can say whatever he wants, but look at his filings. He's taking off every penny from his federal filings. He's a hypocrite. You listen to the Warren Buffett and you tell me Warren Buffett want to lower his taxes? Have him pay for it. Who's nuts? Who's denying? Not have him look at this. Have him give up the money. Let's see. The reason he's doing that because he's taking all the deductions. That's a business deduction. When you have a business, okay, this is another beauty. If you have a business, you want to take care of the employees, you want to take care of their health insurance, you want to do a workman's comp, you want to do their payroll, you have losses. Who's taking the risk? You or me? Who's taking the risk? There has to be a reward for the risk. Warren Buffett can say because he minted the money from the poor, you know, from whatever he must have made good in the investments, but he has no authority to say, oh, you should be paying lower taxes than. He's not the right person to say that because look at his filings, annual filings. He takes every deduction. He's a hypocrite. And you're taking his word and telling people that Warren Buffett should be paying more taxes, and you want to take more money from people who are hardworking Americans. And look at what's happening in Chicago. People who have their businesses being vandalized. These are hardworking people. This is what we need to focus on. People are working hard. And look, Hispanics, they work hard. And I see African Americans, I see more and more African Americans. They work hard. But the, you know, this so-called welfare system introduced by the beauty Johnson, President Lyndon Johnson, I guess, I don't know. This welfare system has destroyed the African American family structure, and they all have become druggies. You're encouraging more into the drugs, and you know you want to cut down the crime. I understand how you want to lower the crime in drugs, but look at the people on drugs. We need to. They, there are so many people. This is where it destroys the families. When people get drugged, they don't have a personal response. They lose their personal responsibility. Americans in general are personally responsible. It is a small segment, and these policymakers are putting words in their mouth saying that they want to help, they want to punish the wealth. Why punishing the wealth? And you want people on the street? This is what you're trying to tell me. People on the street. So they're mentally sick. You don't even take care of the mentally sick, and you want to punish the wealth. Ah, that's Democratic Party needs to change, man. Democratic Party. I am a Democrat. Democratic Party left me. I didn't leave the Democratic Party because Ronald Reagan basically said it is not, Ronald Reagan at one time he was preaching, you know, communism at one time. He himself changed his thinking how communism works. He looked at it, he explored it, he analyzed it, and he came up with the idea. Half the time, it is not the party or establishment. It is the government. When government becomes a problem, that itself, they want all these entitlements. Fine, but do it in the right way. Focus on the people, what they need help. Don't punish the hardworking American. What this Democratic Party is doing is punishing the hardworking Americans. When they vandalize the stores in Portland, Washington, Chicago, what did they do? Nothing. Poor people, all these stores have been vandalized. That they should have been stopped right from the day. If you want to protest, fine. Nobody is discouraging you from protest. But why vandalize? These people who are vandalizing these stores, they have no personal responsibility. They have nothing to look forward to. This is what you're encouraging people to vandalize the stores and no morality, go and have sex and make babies and have abortions. Come on. And live and discouraged from getting married because they lose their Medicaid card, because if you get married, you lose your card. Medicaid. Why do you need Medicaid card? Has got to do with family, getting married. Why do you have to give up on their card? That doesn't make sense to me. Why don't you give them the personalized health care what they need? Provide the tools through public-private partnership. Well, I have enough of this lecture, but I'll keep coming up with. I'm going to create this podcast. I'm enjoying myself, folks. I would love to see interaction between my viewers and the. I would like to chat with you guys. I enjoy the interaction. I'm going to keep. I'm going to. I'll be at work. Try to expand the audience. So let's see where we go from here. Thanks for the coffee. We'll see you tomorrow. Consumers Doctor from Foremost Organization and also from Health Insurance Personalized, folks. Thanks again. We'll see you tomorrow.